Are you tired of your valuable ideas and suggestions getting lost in the shuffle? Well, that is why I'm introducing Direct Suggest, the revolutionary digital suggestion box that puts your voice front and center. With Direct Suggest, you have the power to make a difference in your organization. Direct Suggest provides value to organizations in various industries worldwide, including notable brands like Comcast, TD Bank, and Nokia. And here's the best part. Direct Suggest only costs 50 cents per employee per month, making it an affordable solution for businesses of all sizes. Plus, they have an incredibly high ROI and savings potential with an average 33 times return on investment. The implementation process is also a breeze. Once committed, setting up Direct Suggest from start to finish can be completed in as quickly as a week or less. Don't let your ideas or your team's ideas go unnoticed. Visit directsuggest.com today and start by making a difference with Direct Suggest. Use the promo code HUMANHR for your extended 60-day free trial. Again, visit directsuggest.com to learn more, and remember to use promo code HUMANHR for an extended free trial. Direct Suggest, where your voice matters. Welcome to the Bringing the Human Back to Human Resources podcast. I'm Tracy Chernoff, and I've spent my entire professional career in HR. Each week, we'll explore the delicate balance between people and business with the aim to reconnect the two and create meaningful outcomes. Listen in as I share my own experiences, challenge the status quo, and chat with guests from various industries about our mission to bring the human back to human resources. Hi, everyone. Welcome back to the Bringing the Human Back to Human Resources podcast. Thank you so much for being here for another week. I have to say that this episode is one that I've been eagerly awaiting to record, and you will soon find out why. I have this wonderful guest with me this week, and I'm going to quickly intro him, and then we're going to get right into the subject for us today. David Utley, MD, graduated from Harvard Medical School in 1992, and he then completed his surgical training in otolaryngology, aka head and neck surgery, as well as facial plastic and reconstructive surgery at Stanford University Medical Center, where he was subsequently appointed to the faculty as clinical assistant professor of surgery. In 2003, David founded Barracks Medical, which focused on GI endoscopy and ablative therapy for neoplasia, and served as CMO from 2003 to 2012. Barracks was then acquired by Medtronic, formerly known as Covidien, in 2012, forming GI Solutions. He then served as CMO for GI Solutions until 2014. And in 2015, he founded Pivot Inc., formerly known as Carrot Inc., to solve the global health crisis caused by tobacco use. Pivot addresses cessation for all forms of tobacco, combustible, vaporized, and smokeless. Pivot is a scalable digital solution which is aligned with the HHS practice guideline and which delivers a mobile app experience with tailored behavioral change content, pharmacotherapy, an FDA-cleared carbon monoxide breath sensor, a supportive peer community, and personal tobacco treatment coaching. And for all of that information, please check out the show notes so that you can really learn a lot more about what David is doing and more about Pivot. Again, all of that is in the show notes. But without further ado, David, this is a really important distinction to make, that you have this fabulous background as a physician, and all of this experience has led you to the point to form and create Pivot, which is doing something pivotal, to say the least. And for all the listeners, we're going to talk about something that has never before been spoken about on the podcast, which is really kind of a dichotomy here. One, tobacco use and what that means in terms of costs to the company. And then I will shed light, this is kind of the second point here, I will shed light on some of the maybe more legal elements behind tobacco use or even potentially smoking addiction, where we can add color. So David, thank you so much for being our resident on the podcast, so to speak, our resident medical professional and tobacco, expert. You obviously have the background for it.
Thank you, Tracy. It's great to be here with you.
Yeah, of course. So I think let's start at the top. How did you, of course, I read your bio, so everyone can kind of come to their own conclusions about your background and how, starting in medicine led to where you are today with Pivot. But what really kind of kickstarted for you this interest in understanding tobacco use and being so passionate about really the education and the understanding of what it truly does to people, let alone in the workplace?
Sure. Well, it started when I was a kid. I grew up in the 60s and my parents smoked and my grandparents smoked. And I had aunts and uncles, and all of my grandparents died from tobacco use, and I was a secondhand smoker in the house unwillingly. This is, you think back then, everybody smoked in the country. We still have 30 million people now in 2024 that use cigarettes every day. And so, my personal journey then went to med school and training and, becoming a surgeon at Stanford, where all of our patients that we operate on every week had tumors related to smoking cigarettes, completely preventable, just like most lung cancers are completely preventable. And most head and neck cancers are completely preventable, but we could operate and spend a lot of time and money solving these problems after they occurred, but we didn't have any upstream solutions at Stanford that were highly effective to help people quit in the first place. So after, starting Barracks, which was also a cancer prevention treatment company, and having that be really successful, I started Pivot 9 years ago because someone had to do something about the smoking crisis in the US.
It is a crisis. When I hear that number, when you share, how many people are still, I don't want to say like participating in, it's less about that. And it's more about making the decision, I suppose, to start smoking the first time, which then unfolds into this addiction to nicotine, right? On top of what I believe you shared with me when we first spoke around the addiction to the physical behavior. Of course, I'm sure that there are listeners who are like, this is an HR podcast. Why are we talking about public health and smoking? But really what fascinated me about what not only that you're passionate about, but what you do is that there is a tangible cost to companies and a tangible cost to employers when it comes to those who are smokers or use tobacco. So can you shed a little bit of light on what that cost looks like, how you come to a cost, how you help? I realize I'm asking multiple questions here for you, but how you come to help employers to even see the cost that there is on them?
Sure. So let's start at the macro level in the United States, and then we'll drill down to the employer level. Is at the macro level, 30 million US adults smoke cigarettes mostly daily. And our society tends to vilify people who smoke. The reality is that people who smoke typically started when they were in middle school or high school and became addicted to nicotine as kids and have never been a working age adult without having a nicotine addiction that they have to satisfy every day while they're at work. And most of those 30 million adults that smoke are working age adults in the workforce, working for the people that are listening to this podcast, right? So think about that. 1 in 6 US adults use a cigarette. So 1 in 6 of your employees and 1 in 6 of their spouses and their kids are smokers on a daily basis. So at the macro level, 500,000 people die every year of cigarette smoke. And we generate $600 billion in excess healthcare claims and productivity loss. So for a company, let's just say Delta Airlines, just pulling one out, 100,000 employees about. They spend $162 million a year that they don't have to spend on excess health claims. Those are doctor visits, medications, hospitalizations for their employees and spouses and kids. And they spend, of that 162 million, there's also productivity loss because smokers are less present at work. They have to take smoking breaks. They have more sick days and they're just less productive, sadly. So Delta has a big investment that they could make to save money and become a more efficient company by helping their employees and spouses quit. It's a very clear public health and HR path to success.
Mm-hmm. It's really interesting. And I think I might have shared with you when we first spoke that when I worked for Target back in the beginning of my career, there was basically I want to call it a tax, but essentially a tax on those who smoke. So when you go and it's open enrollment and everyone goes to opt in for their benefits, if you're a smoker, you're charged a certain amount in excess. So essentially there's this surcharge in essence where those who are smokers do have to pay in excess compared to those who are identified as non-smokers. And this is for everyone within the benefits plan. So if you have a child or a spouse or, some other dependent who is a smoker, those premiums are increased. Right. And, naturally, I mean, I'm not a smoker. So for me, I'm like, okay, this is great. My benefits stay the same. No big deal. But actually, the message that that sends, I can only speak for myself, is that smoking is not very much appreciated by the company naturally, because there is some element in terms of the employee experience where someone who is not a smoker is like, okay, great, premiums stay the same. For someone who is a smoker, maybe there is that almost the intrinsic um, message being sent that they should reconsider their choices and that there is a consequence monetarily, financially for them in making the decision to continue to actively smoke. So it's interesting. I have not worked for a company that does what Target did. I don't know if Target still does that, but I would imagine that they do. So when I think about that element of things, and especially for those of us in HR, there is a way for us to drive healthier employees and to drive health in a different way. It might sound for some listeners who might be smokers, especially since you said the ratio is 1 in every 6. Um, there may be people who are like, oh, well, that's not really fair. But when you talk about the cost just in the millions and billions of additional claims, as well as adding up the minutes and hours that go to these additional breaks and what that means in terms of the cost on productivity, there is a justifiable, if you ask me, a justifiable and reasonable moment here for businesses to think about how they disincentivize unhealthy habits like smoking. And maybe habit isn't the right word if people are addicted to nicotine. Maybe it's behaviors.
Right. Right.
When you interact with clients or companies and they don't, maybe they have no idea some of the research that you've come across or that you've done where so many people are smokers and what that really means for their company. They think that, oh, people are just taking 15-minute breaks once a day, it's no big deal. What is generally the reaction when you share these statistics with leaders at these corporations?
Yeah, let me try to just tease that apart a little bit. So we just spoke about large companies like Delta or Target. Target is one of our clients. They're an extremely forward-thinking company. We're honored to be one of their partners. They offer Pivot to all of their employees and spouses on their benefits plan, and all of their employees that are even not on their benefits plan, because that's just a forward way of thinking. And we laud them for that. And they offer our program to their eligible lives for, in these 6-month increments, and they can renew every 6 months to get more support. And they know that a tobacco user at a distribution center or at a retail store or at headquarters has higher claims and has less productivity. And so we can help them with that. And so the one thing that, so for some other companies that have less of perhaps an aggressive forward-thinking tobacco cessation program, we will educate them about the costs and even offer to pilot with them and look at their claims over time with Pivot, because we've been able to show with claim studies at some of our health plans that we can reduce claims so much in the first year in the people that enroll in our program that the program pays for itself. So there's a 1-year payback if you help people quit tobacco. And so the jury is not out. If you look at all the different things that health plans and health systems offer, like breast cancer screening and colonoscopy screening, if you look at all of the things that HR people offer, like flu vaccines on site, medical clinics on site, well baby care, smoking cessation, you look at all those preventive services, tobacco cessation is much more powerful than all of the other ones. You can reduce more cancer and more morbidity, more cost with a smoking cessation program than you can even with flu vaccination program. It's remarkable how powerful it is. So once we've worked with some of our clients, they see how powerful it is. They typically will double down and start to expose or expand the program to more and more people over time.
That's fascinating. And, I often think about those times because I work remotely, so there is no flu vaccine clinic on site here for me. I just go to my local pharmacy and get the vaccine every year. But when I think about my time in office, those were things that we really were excited about, being able to bring, basically healthcare and resources directly to our employees. And that was at Target and other places that I worked. And, when I think about companies today, when they're, maybe is to drive positive culture, to drive employee well-being, a lot of it is how we make these things accessible. So when I think about the accessibility of Pivot and how, for example, with that you've shared with Target being your client and that, these folks have access to the app, accessibility is a big part of it, especially, I try to do a lot of mantra sharing on my podcast, which is one of my favorite mantras is to say, meet people where they are. So that means very physically and tangibly, if you have employees in a retail store, make things accessible to them, whether it's a decision that you're making or in this case, providing something that is physical, like something on site or an app in this case. So I think that's great because that's where we see not necessarily change management happening, but that's where we see engagement, I should say, in whatever initiative the company might have. And with that, I actually have a very specific question for you. And I don't think that we spoke about this previously, which is around this culture of vaping, because I don't know if it was really like the advent of TikTok and other social media platforms, or if it was COVID, but I have seen more adolescents. I sound like I'm 80 years old when I say that, but I really am trying to refer very specifically to this population that you said is more often than not the demographic that ends up being the demographic that is hooked on nicotine, right? Like those who are often those who started from middle school on. So adolescents taking, I guess I should say buying vapes or taking puffs from vapes, and they potentially don't think that the repercussions are the same because it's not smoking from a cigarette. What are the studies the same between vaporless versus vape versus smoking? Like, is all of that the same, or are there different studies about the addictive properties to vapes?
Boy, very complex topic. And so for the HR leaders that are listening, the number one thing that the FDA is saying now is that any form of tobacco, whether it's cigarettes, cigars, vaporized nicotine pouches, et cetera, are not appropriate for anybody under the age of 21, period. So there's age lock, 100% consensus across everybody. For adults who smoke cigarettes and cannot otherwise quit, the FDA and a lot of the scientists are leaning in to the fact that if that person can't quit using a program like Pivot, which is pharmacotherapy, FDA device, modern coaching, that there is a possibility that if they could get onto a vaporized nicotine product and get off of cigarettes, it could improve their health. And I agree with that. The scientists have kind of made that statement. So, but the clients that we work with are, and I agree with this for now in 2024, are not interested in getting people from cigarettes to vaporized nicotine. They're interested in getting people off of all forms of tobacco.
Right.
And so that's what we do as a company. We coach people if they're on vape and they want to quit. We coach people if they're on cigarettes or both and they want to quit. And the one thing I want to say is that if you're an HR exec and you have a public health crisis within your population of like Target or Delta with 18,000 smokers that work for them, if they want to have the biggest impact, they have to bring in a program that's extremely enticing and attractive for their employees to join. And if you think about flu vaccination, 60% of adults get flu vaccines every year. It's pretty high. COVID is the same way. Very, 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 very few people sign up for tobacco cessation programs because they're dull and boring and they're remote and you got to go to a class or you got to talk to somebody on the phone. Our program at Target and all of our other clients gets between 5 and 20 times the enrollment of incumbent programs. And that's because three things. We have a sensor like a Fitbit that nobody else has. We do not vilify and blame our participants. If you just want to learn about tobacco use and some other things, we don't force you to quit. We don't make you quit in the first month. And so and we really understand how to market to consumers, which are the employees. So an HR person can be a wildly successful hero to their organization if they can just get 10% of the smokers into a program every year. 10. It's really, really a low bar. And we can do that, which is the magic here in the public health, arena.
That's really interesting. And you sharing some of the information around the demographics and just the total population makes me think about the potential income demographic. Like, is there research that shows that those who are on the lower scale of income are more often than not tobacco users? Is it a lack of education? Like, is there any information on that?
Oh yeah, CDC publishes something every 6 months that looks at 60,000 U.S. adult smokers that and what their demographics, what their skin color is, where do they live, and combustible cigarettes are a DEI or health equity crisis, right? So the darker your skin, the higher likelihood you are to smoke. If you have partners that are the same gender, higher likelihood that you smoke. If you didn't graduate from high school, or if you make less than 30 grand a year, more likely that you smoke, and the more likely you smoke more cigarettes per day. And the sad part about that is that those lower income folks that work for our companies in the US have to spend the same amount of money per pack of cigarettes as a wealthy person. So they're spending 3 grand a year post-tax out of their pocket when they make 60 grand a year pre-tax. Wow. Instead of spending money on kids' clothes and education and things like that. And that's sad. So we try to help, our program is set up for somebody who reads at the 5th grade level. We have Spanish support. We have, English is the first language in the native app. And we have to understand that this population is not Silicon Valley or Manhattan. It's like Midwest, and it's South, and it's everybody's, everybody, in the country. So that's very important as an HR exec to understand that the most at-risk populations that they employ have the highest likelihood for tobacco use.
Right. That's really what I was hoping to not hear, but be validated with, because I think it does feel fairly intuitive that would be the case. And I think it's just because we know intrinsically that lower income populations and certain races, unfortunately, don't have the same access to, maybe whether it's like levels of education in the US. We know even just depending on what state you're raised in, you don't necessarily have the same access to levels of education that maybe others in city centers do. And it's just, I really appreciate that you mentioned the equity side of this, because that's really what it is. It's not a conversation on, rights or even anything like that. It's really privilege and equity. Like, what does our upbringing look like? What do we have the privilege of having outside of our control being afforded to us, depending on where we're from and maybe even what we look like or how we did grow up. And when I think about this side of the conversation being on addiction, I'm sure that there are questions floating around in the listeners' headspace around, well, tactically, what can HR leaders do if someone, is a smoker and they are taking breaks? Because I should preface by saying it's not to say that there's always a consequence that needs to be applied in order for people to stop something, because that's not always the case. To your point, Pivot doesn't require that people stop smoking in a month or else. Like, this is about exposure and education and opportunity and access. But when I think about just the HR function, a lot of the times the conversation is like, well, what can we do about it? Okay, if we offer all these things, then what? And can these people take breaks because they're taking more breaks than the average person? So I know that anecdotally that is a question that's probably floating around. So the first thing, and I'm certainly not going to pose this to you, so you are not in the hot seat, but I'm sure there's a question around, are tobacco users or smokers or addicts to nicotine, are they covered by the Americans with Disabilities Act? And the answer is actually no, they are not covered under the ADA. And I say this fairly succinctly because a lot of the times I get outreach from HR leaders and other types of leaders in businesses who say, this person, is saying that they're covered by the ADA and I gave them this accommodation and this is what we're doing. And it's very easy as an HR leader to sometimes take someone's word for things when they hear ADA and accommodation thrown around. But it's really, really important as HR leaders to know exactly what that means. What is an accommodation? What does the ADA cover? Because otherwise you get into this territory where you can't break a precedent that you've set. unless you actually physically say, I'm breaking this precedent because this is the wrong one that I've set. And I say
Sure.
that because there is, unfortunately, this element of having to enforce different elements of policies and things like that. And I should also note that 60% of US workers are working on an hourly basis. They're earning an income on an hourly basis. And when we think about that, I would say that similar to the statistic that you shared around those of adult Americans who are smokers, if we know that the majority of American workers are hourly, we can also make the distinction that they potentially are on the majority uh, in the working lower or middle class. And so, if
True.
we understand that demographically, as you've shared before, the majority of their employees could be impacted by different things that they offer, whether it's policies against smoking or offers to improve people's health in preventing smoking. So I just want to make that mention for those listeners who maybe are trying to figure out how to navigate something with a tobacco user in their environments. So with that, I realized I kind of went on a little bit of a diatribe there. Is there anything that you would add to what I've mentioned for HR leaders to think about when it comes to asserting themselves and the policies?
Well, I just think around I'm not an expert in HR law, but around tobacco use in employees, um, we know what works and what doesn't work to help them quit. And so if a HR leader imposes a surcharge on somebody that smokes so that they have to pay higher premiums, uh, the only good that comes of that is that there's an incentive for the person to join a quit program like Pivot. It doesn't help them quit. It
Mm-hmm.
does. We have seen that it helps them explore options of joining a Pivot program to reverse their surcharge. And
Mm.
then it's up to the program. So I call that it's the carrot and the stick, or the hammer and the soft hand, where the hammer is the penalty. Extrinsic motivation does not help people change behavior, but it might get them to sign up, right? And then it's our job. So we are purely intrinsic motivation. It's kind of like saying to you, hey, Tracy, we're going to charge you $2,000 a year extra if you don't run the Boston Marathon this year, which is
Right.
kind of crazy, right?
Mm-hmm.
Instead of saying, hey, listen, just sign up for this program and you're going to learn how to walk and you're going to get some running shoes and jog a 10K. And, it's much more, you build the motivation to do the thing, because the only way we can durably change behavior is with intrinsic motivation, skills building, and support with a coach and pharmacotherapy and everything. So I support surcharges only in that they help people seek out a program to reverse the program or reverse the surcharge. It doesn't help them quit at a higher rate. We help them quit at a higher rate once they're
I
in.
think that's a very, very important distinction to make. And it really makes me think about this idea of change management, which is very, very commonly used and referenced in HR, because essentially, if a business naturally needs to make some sort of change, whether it's change in leadership, changing teams, changing in department or organization structure, or even in this case, wanting to roll out maybe a new program, there
Sure.
has to be the understanding of what X and Y are and how you get to Z. So if X is the problem that you have, maybe 40% of your population are smokers, and then Y is that you want to roll out the surcharge, it's not a straight line to Z, which is to get people to stop smoking. There has to be that additional step. And it really is very commonly a misstep in change management efficacy, I would say, in businesses. I've even seen this myself where I've thought, oh, okay, well, we have this problem and this is how we're going to solve it. But we haven't really necessarily thought about, well, when we solve it, what do people do? Do they feel differently? Do they, in your case, seek out other avenues for actually attempting to quit and put the addiction behind them? And so it's figuring out that additional step that can be the hardest. So I appreciate that you've already solved that for us. That it's like, okay, well, you can implement a surcharge, you can do things that are consequential, but when you do that, you have to it's almost like you've guided people in this direction, but you can't leave them in a room without a door. You have to allow them the opportunity to seek out other options. So I think that's probably the most important thing if HR leaders listening to this are actively trying to improve the health and the employee population. So I think with that, you've answered you've answered all of my questions. The only other thing that I think we maybe would benefit from hearing your perspective on is how, in the event that an HR leader says, okay, this program would be really useful for us. Let's say they even roll out Pivot. We're implementing a surcharge. We're rolling out Pivot. We have people who are going to have this consequential action based on their, unhealthy behavior. And they have a resource so that if they decide to seek out a better option, they have that. What happens when a percentage of that population chooses to take on the surcharge and not seek out healthier options? Have you seen that happen? What does someone do in that case if they're like not satisfied that these, additional percentages of people are not seeking a healthier way of life?
Well, I mean, you can only do so much in a population. You can offer them the opportunity to change. I mean, if you look at the 30 million people in the U.S. that smoke, 70% say they want to quit in the next 6 months, but they can't. Like they don't have the services available to them. Half of them try, most of them try cold turkey, and they fail because they don't have any skills and support, and they don't know the best practices. So if you have a large population of smokers like Delta, the example we used earlier, if I was the HR leader at any of these large companies, I would do everything in my power to incentivize people to join a program like Pivot. Because, somehow, we can get 65% of the population to be compliant with breast cancer screening guidelines, 70% to be compliant with flu vaccine guidelines, but like 1% are compliant with signing up for tobacco cessation, even though tobacco kills more people than breast cancer, ovarian cancer, lung cancer, all combined, right? Mm-hmm. And so if I'm an HR leader, I would say, listen, this is top of my list. I know I have to address obesity. I know I have to address mental health. I know I have to address smoking cessation. Those are the bigs. And I'm going to put all of my power behind these very expensive cost centers that are costing me $1 million, $2 million, $1 billion a year, depending on how big the company is. And we're going to get the best solutions in there. We're going to incentivize people to join rather than penalize them for being smokers. Because we don't penalize people for being overweight. We don't penalize people. We don't surcharge people because they have mental health issues.
Right.
Tobacco use is a mental health issue, chronic addiction, just like diabetes, right? So I would encourage everybody to keep a really open mind and just be very aggressive about getting as many of your employees and their spouses into an evidence-based program like Pivot. And you'll see the P&L change within a year.
Amazing. And actually, I do have one final question for you that I thought that was the last one, but apparently I was joking. What is the success rate when someone does join Pivot, for example, or a similar program? What's their success rate in quitting and staying off of tobacco use?
So I look at from a public health viewpoint, and you're trying to tackle a condition that causes cost and morbidity and death. You have to look at what's the enrollment rate and what's the quit rate. What's the enrollment rate? What's the prevention rate for colon rectal cancer, for example, when you're screening? And so for people that are enrolled, about 1 in 3 of them durably quit, and we have data out to 3 years. That's a really high quit rate.
Wow.
But if you just talk about quit rate and you forget about the enrollment rate, you're missing the biggest opportunity that there is. We get 5 to 20 times the enrollment rate of other programs. And so you can get 5 to 20 times the quitters at that 33% quit rate. So everybody should really think about the engagement piece. How many people are signing up for your program, whichever program it is, for diabetes prevention, for weight loss, for mental health, for tobacco. And then what's the success rate? You got to think about both of them. And so I think that we've got the best program in the market with the best data, and our clients would support that right now.
Yeah, that's amazing. I think what you're doing is valiant, and I think it's a really important effort that you're making and providing people with the opportunity to take part in. So Thank you so much for taking the time out of your busy, very busy schedule to share more about what you are doing at Pivot and why it is so important, and how those who are listening can really help to improve the overall well-being of their employee populations and maybe even for themselves. So Great. Thank you so much.
Thanks, Tracy. See you.
See ya. Hey, just before you go, don't forget to subscribe to this show so that you are the first to hear when an episode drops each week. And maybe leave a 5-star review and a comment about how much you loved this episode. Plus, if you have someone in mind who would really enjoy this episode, make sure you share it with them. Thank you so much for tuning in, and I will see you next week.